1314 curette is for the distals of the premolars and the molars. We'll start in quadrant 4, buccal. To determine the correct working end, it's the same as the 1112 Explorer. You'll line the terminal shank parallel to the long axis of the tooth, the distal here of number 30, and if the handle comes out of the mouth nicely, you know you have the correct working end. This is the 14 end, and we'll start by demonstrating an assessment for an exploratory stroke. We're going to start on the distal line angle of tooth number 30. We're going to try to close our face as much as possible to that 0 to 40 degree angulation. We're going to try to tip the toe as much as possible, and we're going to work going distally. We're going to float subgingivally, and we're going to feel the root structure. If we come upon any granulation or any calculus, we're going to lock onto the toe third of our curette and open the blade like so. If there's just a little bit of calculus or a small amount, we're only going to open the blade up to probably about 60 degrees. And we're going to work our way around the distal, floating down, feeling, opening, and then relaxing the hand. Float down, feel, open, and then relax. Float down, feel, open, relax. Open, relax. So when we're opening to remove the calculus, we're now using the work stroke or the calculus removal stroke. The assessment stroke is to feel or disrupt biofilm, and the work stroke is to remove. And that's the only time lateral pressure is utilized. And we lean on our fulcrum, lift the calculus, we let go of the lateral pressure, ease off the fulcrum, which is in essence our brake, and we close the face again so we can float back down. When we get to the distal, you'll see that the terminal shank is parallel to the long axis of the tooth. And when you've completed cleaning the distal, you can slide back out. We'll then go on to the distal of the premolar. We're going to start more towards the midline with the premolar. Try to close the face. We'll probably get to about 20 realistically. You don't generally get all the way to 0. Float down. Feel our terrain or our root structure. We come upon calculus. Lift, and then relax. Float, lift, relax. Lift, relax. Lift, relax. Lift, relax. Float back out. If we know our patient only has biofilm or plaque and there's no calculus present, we'll determine that with exploring. We're just going to be doing a biofilm removal stroke. Similar to the assessment stroke, you float in, but this time you're closing the blade or the face onto the tooth. And you're just lifting lightly biofilm in the subgingival area. So you're closing versus the work stroke, which is opening. '16 Gracey, which is a mesial instrument. It also does the buccal wall, the lingual wall, and the actual mesial interproximal. We determine the correct working end once again, just like the 1112 Explorer. We take the toe, place it interproximally, line up with the long axis of the tooth, the terminal shank, and the handle comes out of the mouth nicely. So we're going to start at the distal line angle. We're going to try to close our face to 0. We're going to slide subgingivally from the get ready zone, feel our terrain. I feel a little granulation, a little bit of calculus. I'm going to lock onto my toe third, lift, relax the hand, float back down. Lift, relax. Lift, reassess as I go. Small 1 millimeter overlapping strokes. It's very important that you close the face to slide back down again. And as you assess, you're only opening very modestly, probably about 20 to 30 degrees. If you don't feel anything, you're just going to do a close, like a biofilm removal stroke. If you come across deposit, you're going to lock under it, lift, and then release, and reassess how you did. We know when we get to the mesial line angle, that familiar ding, ding, ding will happen in your head, and you'll know that you'll need to turn more so, reestablish your fulcrum, so that you can get the face closed as much as possible to slide into proximal. Assess, lift, and if you're not feeling anything, it's just going to be the biofilm removal stroke. On the premolar, you start at the midline, close the face as much as possible, slide subgingival, feel that terrain, lift, close, float. Lift, close, float down. Lift, close, float down. Again, if you're not feeling anything, you're just going to close the face and the handle moves towards the tooth to just do biofilm disruption or biofilm removal. If you come across, build up again, calculus, you're going to lock under it, lift, and then release. Go back down and reassess. If you go down and you're assessing and you feel the calculus, and you open and nothing's happening, you don't continue to pull through. You relax the hand, close the face, you abort the mission, and you float back down again, reassess, and get at a different angle before you open again. You never want to pull through because you could hurt either restoration or the tooth structure itself. What it means is that you have the incorrect angulation. Mesial line angle, you'll turn a little bit, float, lift, release, lift, release. If you're not feeling anything, you're just closing to disrupt the biofilm and slide back out. And by using the toe, placing our fulcrum, place the toe into proximal, line the terminal shank up with the long axis of the tooth, and the handle comes out of the mouth nicely. So this is the end 13, working end 13. We'll demonstrate on tooth number 3. We'll start at the distal line angle at the get ready zone. We'll try to close our face as much as possible to 0. If you'll notice, while I'm working on the buccal, I'm fulcruming on the lingual occlusal cusp. You don't want to be right on the direct occlusal because then you are in the line of fire. It could be very dangerous. Also, you want to be on the lingual cusp so you have a leverage situation going on. You're actually using leverage to lift the calculus, not just hand muscle. So once we've established our correct working end and our correct adaptation of 0 to 40 angulation on insertion, we're going to slide subgingival. We're going to feel our terrain. If we feel calculus, we're going to lock onto the toe third, open to about 70, and then relax the hand. Float down again, feel, open, relax, feel, open, relax, open, relax, open, relax. If we don't feel anything, we're just going to be doing a biofilm removal stroke. And that's just disrupting the biofilm, maybe smoothing things a little bit. And we float out. We'll then move on to tooth number 4, which is the premolar, so we're going to start in the middle. We want to use our adaptation of 1 to 2 millimeters of the tip. We're going to use our 0 to 40 angulation upon insertion. We're going to slide subgingivally. We're going to assess our terrain or our tooth structure. If we feel calculus, we're going to lock onto the toe third. Lift the handle. If nothing happens, we abort the mission. We relax the hand. We float back down. We try to get under it at a little bit different angle. And we lift again. We relax. Lift, relax. Lift, relax. Lift, relax. And that's the little biting snap noise we're looking for. We're definitely not looking for a drag. We're looking for one little tiny bite sound. Hopefully 1 millimeter length strokes. And again, our fulcrum is our brake. If we let go of the pressure or the lateral pressure on our fulcrum, that will stop the stroke. And we want to do that at about a 1 millimeter length. If we're not feeling anything, we're just doing biofilm disruption. And we're just closing the handle and smoothing.